Hello everyone, welcome to Good Guide Show of ABC Magical World. I am Amanpreet Singh Arora, CEO of ABC Magical World Preschool Chain. Today we have a renowned pediatric neurologist of Ludhiana, Dr. Gurpreet Singh Kochar. Welcome sir.
Hi, Aman. How are you?
Fine sir, what about you?
I'm fine.
So Dr. Gurpreet is a renowned pediatric neurologist working with SPS Hospitals Ludhiana since 2011. He specializes in pediatric neurology, like brain diseases in children, like headache, epilepsy, development-related problems, autism, behavior disorders, etc. So, so we'll be talking about a very common and less understood problem of children, that is bedwetting. So, sir, I would like to ask few questions to you. What is bedwetting and how common it is?
Amanji, bedwetting is a very common problem. In simple terms, we say that whenever a child who sleeps at night passes urine in the bed, that is bedwetting. We also call it nocturnal enuresis. So how common is it? It's very common. We all know that the child starts to control their toilet habits by around 1.5 to 2 years of age. And by 4 years of age, most of the children, they achieve the bladder control. But still, by 5 years of age, around 25% of children, they wet their beds. Until this percentage falls down to around 10% by 7 years of age. So in other words, around 1 in 10 children of class 2 will be having bedwetting problem. And that is completely normal, completely physiological. And most of the time, no treatment is required and there is no worry in that. So it's around 10%, you can say the prevalence of nocturnal enuresis is around 10% beyond 7 years of age, right?
So, is it a disease or disorder, or does it cause any harm to children?
We do not call it a disease or a disorder because it's by 5 of age, as I explained, it's a normal developmental process of the child. It's part of a normal childhood development. So we will not cause it a disease till it causes some problems, like it may harm the self-esteem of the child. The child may not be able to socialize properly. In the world where the campings are so common, where this sleepovers these days in kids are very common, the child may find him lagging behind the other kids and he will not like to socialize. And it may cause harm to the parents because they will not like to talk about this thing in front of others. They will feel bad about the smell in the bedroom whenever the child wakes up. So these are the harms which this enuresis may cause. I would like to add here one thing, that nocturnal enuresis or bedwetting is of two types. One is primary nocturnal enuresis, when the child has been wetting his bed throughout. I mean, he has never been dry till date. And secondary enuresis is when the child had been dry and he had achieved his bladder control for 6 months, but now again he has started wetting his bed. So that is secondary enuresis. 75 to 80% are primary enuresis. So we do not need to worry about them. But these 20 of the cases, they need help, they need assistance of a doctor, or they need to talk to their pediatrician for that.
Okay. So, what are the basic reasons of this problem?
Amanjit, nocturnal enuresis is a multifold problem. I mean, there are a combination of causes for nocturnal enuresis. One of them may be, it is not very properly understood, but still one of them may be delayed maturation of the brain circuits. I mean, whenever there is, we need to understand that kidneys produce urine. Our jo gurde hote hain, they produce urine. It is stored in the urinary bladder. So when the bladder gets filled, there is a signal from the bladder which goes into the brain and asks the child to go and pass the urine. So this maturation of the signals, it occurs by 5 to 6 years of age normally. But when there is delay in this maturation, I mean, the circuits are delayed in maturating, that's the basic reason. That may be one of the basic reasons why there is nocturnal enuresis. Secondly, many children, they are not able to control their urine at night. I mean, they have nocturnal polyuria. The urine production, it usually decreases in the night in normal kids, but in children with nocturnal enuresis, the urine production increases. it may be due to reduced ADH. There's a hormone which reduces the urine production that is deficient in some kids. And genetics plays an important role in this. If you see the case studies, the literature, if one of the parents has the history of nocturnal enuresis, then the risk of having a child with nocturnal enuresis will be 40%. And if both parents are affected, it is nearly 75%. So genetics play an important role in this. And there are many other causes, like if the bladder of few kids, they are small, it is called a small capacity bladder, or the muscles around the bladder, it becomes hyperactive, overactive. Instead of relaxing, it contracts prematurely. That causes nocturnal enuresis. And I told you about secondary nocturnal enuresis, in which the child had been dry and then he has started wetting his bed again. In these cases, there are many other things, like constipation is very important. Constipation, it causes there's an organ called rectum where the stool is stored. It causes pressure on the bladder, and it reduces the capacity of the bladder. That is a very common cause of nocturnal enuresis. Like some diseases also, like diabetes mellitus, diabetes insipidus, urinary infections. So these all things need to be ruled out before causing it a primary nocturnal enuresis.
Okay. Sir, what is the line of treatment for this, sir?
Line of treatment is whenever a child, suppose I get a child of a 7 years old girl or a boy who comes to me and says that parent says that he is very concerned. So our parents are also very concerned. So I tell them that, have you seen any adult wetting his bed? So they say no. So that's how I start. He will also be controlled whenever as he grows. So most of the kids do not need any treatment. Most of the kids do not need to even visit their doctor. Most of the parents know this, that if we are wetting our beds, the kids will wet the bed and he will grow out of its own. But sometimes, yes, if it causes problem in primary cases also, like his self-esteem is low, he's not able to go to camps, then they need treatment. The treatment needs to be the lines of treatment you asked, it is behavioral therapy, psychosocial therapy. Then there's a treatment called as alarm therapy. Thirdly, there is a treatment with medications that is very less required. So most of the children do not need treatment. The first treatment is behavioral intervention techniques, right? So behavior intervention techniques is, first of all, we need to reassure the parents and the child that there is no need to be scared of. It is a normal phenomena. You will grow out of it.
Okay.
No need for the parents to punish the child. Do not feel embarrassed. There should be no guilt that it's my fault or it's parents' fault. It's nobody's fault. We need to tell the parents. And most of the times, the children will themselves understand and they will grow out of the problem. If you punish the child, it will cause more anxiety and it will worsen the problem. Second is reward system. Instead of punishing, in schools, you use reward system, and you have seen the benefits of reward system. In nocturnal enuresis, we apply in a way, we make a calendar of wet and dry nights. So the dry nights, the child will give him a star himself, or the parents will give a star, right? Red star. So if there are 10 red stars, he'll get a big gift out of it. He'll get a reward. Every dry nights needs to be praised, and every few dry nights need to be bribed. You can say that a gift should be given. And this simple method has shown to reduce it by 10 to 15% of cases, right? So this is behavioral treatment. And second is your second lifestyle change you can make is the fluid intake. Suppose the total fluid intake in a child is 1 liter. So ask the parents to give 800 ml by 5 p.m. and rest 200 ml after 5 p.m. So we have to reduce the fluid intake in the evening. Do not restrict the total fluid intake. Let it be the same, which the child used to get earlier. But the percentage should be like 40% in the morning, 40% in the afternoon, and 20% in the evening. So you need to reduce the fluid intake. Third behavioral change you can do is to make the child pass urine at night every day by routine. Whether he wants to go to the urine to bathroom or not, he should sit there for 5 minutes, right? So these are the behavioral changes which we need to make. Then comes the role of alarms. Alarms are of two types. I mean, one is simple clock alarm. What we can do is we note the time when the child passes urine in the bed approximately. For example, he passes at 1 a.m. So we keep the alarm on for 12:30 a.m. and wake up the child. Do not lift the child and go to the bathroom. We need to wake up the child, make him aware that you are passing urine in the washroom, right? And then come back and sleep. And if suppose by accident he passes urine in the bed, wake him up, make him clean the bedsheet along with the parents. Do not scold him, but it should be his routine that I have passed urine in the bed, so I need to clean. So that also is a good motivation for the child to be dry at night.
Right.
Right. Another alarm system is a bed alarm, which is commercially available. There are few alarms which are available, which are called as bed alarms. The one of the lead of the alarm is fit into the pajama of the child, and whenever the child passes urine in bed, the alarm goes off, the bell triggers, and at that time usually the children are bit difficult to arouse, so the parents have to wake up the child. Okay, parents have to wake up the child and then make him pass the urine in the bed and then clean the bed. But there are some rules to use of bed alarm. Parents need to understand that this is a difficult therapy. You need to be motivated, the child need to be motivated. It's a hard working process, and it starts working after 6 to 8 weeks of continuous use. 2 महीने तो पहले उसने काम नहीं करना, 2 महीने से पहले, ठीक है, उस टाइम तक आपको पेशेंस रखनी पड़ेगी, and after that time the child will get conditioned to the wet pajama and he will get up on his own. It has shown to be effective in 50 to 80% of cases. Right? So these are commercially available. We can share it sometimes later. Okay. Lastly comes the role of medication, which is very less. Medication requirement is when suppose a child, I told you nocturnal polyuria is there. The child passes more urine at night. So there are some medicines called as like desmopressin, which can be used to reduce the urine output, but this should not be taken without the help of a doctor. Because it has some side effects when used improperly. So take the help of your doctor. Some other medications like oxybutynin and imipramine may be used, but in appropriate settings with appropriate advice from your doctors. So that is the line of treatment of nocturnal enuresis.
So also that when should parents seek doctor's help for bedwetting? Doctor के help कब seek करनी चाहिए?
Okay. First of all, they should come to the doctor when the child is more than 6 years old and it still continues to wet the bed. Because doctor will ask some questions. There are some questionnaires which are available. He will ask about general health, whether there are any cause of secondary enuresis. So if the child still continues to wet bed in more than 6 years of age, they should consult. Secondly, when there is secondary enuresis, when the child has been dry for 6 months and then again started wetting his bed, then they should consult a doctor. Thirdly, there are some red flags, like if there are any symptoms. Mostly nocturnal enuresis is nocturnal only. I mean, it will happen in night only. If there are any daytime accidents, if he wets urine during the day, then they should consult a doctor. If there is any constipation, they should consult a doctor. And if there is any difficulty in passing urine, I mean, the urine stream is not forming properly and child has to strain while passing the urine, or the child has burning micturition, burning sensation while passing the urine, or if the frequency of urine is quite high, then they should consult a doctor. And some diseases like diabetes should be ruled out. So if there is an increased thirst, sugar की बीमारी है, diabetes insipidus है, उनका urine का volume बहुत बढ़ जाता है. अगर यूरिन बहुत ज्यादा दिन में भी पास करते हैं, प्लस वेट लॉस हो रहा है, प्यास बहुत ज्यादा लगती है, any other symptoms of any disease, then they should consult a doctor. So these are some red flags which parents need to know.
Thank you very much, Doctor, for your guidance, and thank you for being a good guide for the day. I hope all the myths have been busted and facts are clear to the parents also. And thank you, parents, for watching us. So stay home, stay safe, stay healthy. Bye bye. Thank you so much.
Okay, thank you, Amanji. Thanks a lot for inviting me.